So in the last few years, there have been lots of really exciting developments in the world of CGM. First of all, they're far more user-friendly. People can wear them much more easily, they've got more accuracy, and they're a lot smaller in size. But actually, the evidence base is evolving rapidly as well. We've now got evidence that they work not only with CGM and pumps, but also CGM and multiple daily injections. So it doesn't actually matter what the insulin delivery is. CGM delivers benefits in terms of HbA1c and hypoglycemia, and that's fantastic news for people living with type 1 diabetes. So I think overall, the people more likely to benefit are probably those living with type 1 diabetes. As we know, there's high glycemic variability. Getting the glucose to target is really challenging, particularly without hypoglycemia. And there's some fantastic data showing that CGM can help reduce hypoglycemia, reduce glycemic variability, and improve HbA1c. So that would be my number one priority group. But I think increasingly there's going to be a role there in insulin using people with type 2 diabetes as well. So in terms of real-world data and CGM, I will speak particularly about flash glucose monitoring because I've been part of the team leading the ABCD National Freestyle Libre audit data, where we've now had almost 5,000 participants' data input into the audit, and the follow-up data from almost 1,300 patients has shown a substantial 6 millimole per litre reduction in HbA1c and improvements in hypoglycemia. Data collection is ongoing, but hopefully we'll be able to have a big bank of data there that will help support use, particularly when we look at the data for admission avoidance in the future. So the main advantage of flash glucose monitoring is that we've got good RCT data showing that it reduces hypoglycemia. However, we also know from observational studies that it can help improve HbA1c. It's small, it's relatively affordable compared to other systems, and we have seen a massive increase in the number of people using the system. I'd say that the main downside is probably skin reactions. We do see these in a small proportion of people using them, but hopefully as the sensor develops, that'll become less of an issue, but that certainly I'd say is probably the main downside at the moment. So the next major advance in this field has got to be the development of the closed loop system. We're seeing more and more studies coming through showing that it improves HbA1c, improves time in range, and it reduces hypoglycemia. But most importantly, there's high treatment satisfaction improvement in quality of life. And I certainly, in the UK, will be helping promote access for people living with diabetes as more systems come to the market.